Right, if your patient is quite unwell and they need blood cultures and venous blood gases, and they also need other bloods, this is the procedure. So you wash your hands and you clean your tray thoroughly, and then let that dry. Once that's dry, you can put all your equipment on it. So you'll need a dressing pack, and you'll need some venous blood gases, and you need some blood cultures. So the pack, you can take those out while you're up to it. The blood culture pack has these cleaning swabs on the top of it. So you open your pack. This is an all Wales pack, so it can be used for different centres around the country. So once you've opened your pack, you need to make sure you've got everything ready. So you need to get your bloods ready in the corner. You need to grab your towel and put it underneath. Make sure that your towel is the right way around. This is the absorbent side, so make sure that's facing the ceiling. Okay. So we need some sterile gloves just in case we need to repalpate at the arm. So what you need to do is identify your vein, put your tourniquet on, gel your hands, identify your vein. If you found a vein, just undo the tourniquet. So you need to put some gloves on. Non-sterile is okay at the moment. So you need to clean the skin thoroughly. There's a 0 tolerance for touching the skin after you've cleaned it for blood cultures, because we don't want to contaminate the skin, because you'll have a false positive results. So click, this is a cleaning fluid, click these 2 plastic clicks together and the fluid will come to the surface. Obviously you can't touch it because of the ANTT principles, and clean for 30 seconds. So clean thoroughly. And then if the veins aren't very good and you then need to palpate, then you have to put your sterile gloves on and not contaminate them just before you're going to touch the skin again. So clean for 30 seconds, and then clean around, and obviously don't come back again. So once you've cleaned the area, you then just get your equipment ready. So on the packs, as I say, you've got these swabs. So you do, I know these have been removed, but you flick the tops off the blood culture, and then you clean with a portion of this that you haven't touched. So clean for about 15 seconds. Make sure that's nice and clean. And then you clean the other one. These are just like the Clinels, they're 2% chlorhexidine and 70% alcohol. So if you can't find these, the Clinels will be fine. Clinel wipes. So again on the second one, clean for 15 seconds thoroughly and let those dry. So you can only take blood cultures with a butterfly needle because of the safety. So it's dangerous if this fluid actually goes through the line and into the patient. So you can't take it with any other needle apart from the butterfly. And there's one in the pack for you. So open the needle. You can put your Vacutainer holder ready. Make sure that you don't touch the key parts. So that's all ready. You've got your venous blood gases syringe, and you can leave that on to make sure that the key parts are protected. Now the tourniquet goes back on, and then the order of draw that you can see just here. The order of draw is that the blood cultures are always before any of the bloods that you need to take. So you use the butterfly, bevel up, and obviously you don't touch the skin, but you can touch just underneath to make sure that you pull the skin taut in, and then with the butterfly you'll get a blood return just there. So blue first, take your blood cultures, make sure that you place the bottle lower down so that you don't have any risk of this bottle turning so that the fluid goes back into the patient. So make sure that you fill the bottle to where the mark is, and it's a vacuum bottle, so it should stop when you're full, and then just gently shake it. And then the next one. Take that bottle until that's full of blood. And then you take your other bloods. So you take your other bloods according to the order of draw. So whatever bloods you need, whether you need a renal liver bone and a CRP. But once you're through once the first bottle is half filled, you undo the tourniquet. And then you invert. Make sure that you invert these about 5 to 8 times. So then you take your CRP if you need a CRP, and any other bloods you might need. And then your full blood count. As long as you take them with the order of draw, that's fine. You can just invert them all at the end if you want, grab them all and invert them 5 to 8 times from top to bottom. So now you can take the needle out. No, not yet. I need to take the venous blood gases. So you take the needle off, and what I tend to do is to pinch the end here, take that off here, and then take your venous blood gas, about 1 ml, and then you can take the needle out. So somebody will be able to take that straight to the machine to analyse it. Make sure that you pinch on here, because once you undo it, the blood will come out just here. And then you need to make sure that you press the gauze down after you've taken the needle out. So take the needle out, press it down, and then you need to deploy the safety. So this is a safety. You need to put your finger and thumb at the bottom of the yellow and just move up, so that this, and then you hear a click. So get rid of all of that into the sharp spin and press on here for a couple of minutes.